Hi again, folks. Dr. Mike Breen here from the Chiropractic Family Care Center. Wanted to take a few minutes here just to describe a bit about the chiropractic, the traditional chiropractic model that I use. If some of you are visiting this site looking for information about spine-related issues, pain-related issues, musculoskeletal related care, this video might be for you. The work that I do is technically called chiropractic biophysics. It's a particular technique model that's used within chiropractic. Not too many chiropractors use this, but the focus on chiropractic biophysics, as you might get from the name, is that it's really based upon mechanical-based functions. In a simple word, it's posture is what it boils down to. Everyone talks about having good posture, and yet what really can be done for it. When you get right down to it, the essence of what I do is summed up in this one comment in a very simple way, and that is this: you cannot roll a square wheel. The wheel has to be round before it will roll. So if a person actually has structural changes in their body, and these things are remarkably common, we see them in just all kinds of people. If the spine is not lined up the way that's supposed to be, the pelvis, the neck, the skull, basically the entire skeletal system, if it's not lined up, then there will absolutely be increased mechanical loads as a consequence of everything that you do, whether it's sitting in a chair, walking down the street, or doing Ironman triathlons. It boils down to this element of what we call mechanical efficiency, and that's the point about the square wheel, is that if a mechanical structure is not lined up the way that it is supposed to be, then it doesn't work with its highest level of efficiency. And you can imagine with a square wheel, it won't roll properly and things will break and wear out. And in a human body, one of the great consequences of having mechanical inefficiency is pain. The structures of the body, the joint structures, the joint-related structures, the capsule of the joint, the ligaments, and particularly the soft tissues in the body go into states of reaction or response to this level of mechanical inefficiency, and we know them as back pain, we know them as tendinitis, we know them as a whole host of other names, and yet when you get right down to it, the mechanical inefficiency that drives the problem is what needs to be solved. You can take pills and you can put ointments on these things. They may give you temporary relief, and that's not a bad thing, and yet in the end, people suffer for long periods of time. And so really the root cause of many of these issues is actually solving the mechanical problem, and that's the nature of the work that I do. So if you're suffering from low back pain, neck pain, headaches, shoulder pain, anything that exists in the musculoskeletal system, it's really incumbent that we take a look at the mechanical nature of your body and see if that's the source of the problem. That's the kind of work that I do, and I can help you out with it.